we use it as a kind of a screening tool, but really don't factor it too much into our final evaluation of an applicant's application.
Students' GPA, there is some consideration as far as did they do okay in school. However, with more schools moving to a structure in which they aren't getting a A, B, C, and a GPA score, it's harder to compare students, and so it's become less and less a part of our rubric.
So we have a school in town that, the only school in town for Las Vegas doesn't have GPA, so we counted less than I would say most programs probably would.
So the GPA is one of the 4 components of the overall application that we do review. So it's 25% of the score for the applicant.
Not very much, especially now that there's a lot of schools that are pass-fail, so that's really difficult to be able to really compare students fairly and equally across the board when they're coming from so many different schools. I'm from Washington State, and we have 2 pharmacy schools. The University of Washington uses a GPA system, but Washington State University uses a pass-fail system, and we get a majority of our applicants from those 2 programs, and so just that in itself makes GPA really difficult to take into account while still being fair to everybody. That being said, if a GPA is available on the application, we do review it. We have decided year after year to not have any cutoffs. Some programs do have a cutoff of, okay, if you have a GPA less than 3.0, your application might automatically be not further considered, but we have decided not to do that so that we can give every student a fair chance at being reviewed as a whole rather than just in part due to their GPA.
Yeah, so I guess on their transcript in terms of classwork, their therapeutics courses, so kind of those come together all-encompassing courses, are something that I in particular really look at because that's kind of the culmination of your academic experience. And then on their CV in terms of APPE experiences, it's nice to see for our program, which is completely ambulatory care focused, looking for those applicable experiences to see if the student has had that sort of experience and it fits with their interests.
Choosing to take some electives and more inpatient topics. So we're an acute care residency program, and so often some of the schools of pharmacy don't offer courses in TPN management or critical care practice. So if the student is indicating that they're taking these additional elective courses in order to prepare themselves for an inpatient practice, that's something that we're looking for.
I look for critical care and infectious disease rotations, just because I know that's something that will be necessary for success, getting those 2 skills. But really any very acute care rotation would I'd consider.
And so we are more of an acute care focused residency, and so we really like to see rotations where the student has had exposure with inpatient rounding, as well as have an experience in critical care or emergency medicine, and a rotation in infectious diseases, and also a rotation in some exposure to ambulatory care as well.
Courses-wise, we try to look at some, mostly like the therapeutics courses, because that's where you really get the meat of, your clinical knowledge and start building on that. And so looking at the performance of those courses might be a better predictor of how well the student would do in terms of, taking the NAPLEX and passing that, and also doing well on their clinical rotations. APPE-wise, we look for hopefully at least the student had a couple of different inpatient rotations. That could really help prepare the student to kind of do well from the get-go when they start their inpatient rotations as a resident. And of course, that's more specific for institutions like ours who have a lot of, required inpatient rotations. Whereas if you did a PGY1, that's more ambulatory care focus, and that's maybe not as important for them. So having a good variety of APPs, good, whether it's ambulatory care or inpatient. And inpatient, we'd like to see at least 2 if possible. But we do understand that the APPE rotations is not always within the control of the student too. Sometimes the school just kind of has more of a lottery system, so the student can only do so much about it.